Good day, everyone. Welcome to my public lecture. My name is Abidoba Oyekenu, and today I'll be talking to you on the access to healthcare for children in U.S. prisons. I will be reading from the book Economic Evaluation and Marketing for Healthcare Professionals. It was written by my mother, Yewande Oyekenu, and she dedicated this book to me for my 16th birthday. I will be reading chapter 2 of the book, which is related to the topic we are discussing today. So let's begin. Access to healthcare for children in U.S. prisons. Whether they committed a crime or got there by their mother's arrest, children find themselves in prison and need health services, which may not be of good quality compared to standard hospital services. Daniel 2019 explains that U.S. prisons were structured for a more masculine occupancy, and this affects the availability of prisons suitable for their female counterparts with social issues and inadequate health facilities for the female gender. Children are born in prisons due to inmates who are already pregnant when they were sentenced or by sexual activities occurring within the jails. Inmates can be female teenagers who are not excluded from the issue at hand, leading to healthcare needs for both the teenage mother and the newborn. Unfortunately, babies cannot be housed in prisons and are taken away from their mother, leading to depression for both the mother and the infant. Daniel 2019. The aim of this chapter, therefore, is to examine the need for healthcare for this special population who are not only financially hindered or legally hindered from accessing healthcare services due to lack of resources and regulations or policies of the prison facilities, thereby leading to poorer health outcomes than their counterparts who are not in prison. The case study done by Call in 2019, which talks about the problems with accessing healthcare in US prisons. A case about a teenager living in Pueblo, Colorado, is reported by Call 2019. In the story, the teenager had a wealthy lifestyle that consisted of frequent family vacations, going to movies, engaging in sports, and accompanying his aeronautics engineer father on business trips. He also had other siblings. As an early teen, he had been arrested for underage driving and under alcohol influence. During his late teens, he was arrested again for stealing a car, which led him to prison for 1 year. Upon completing his time in prison, he relocated to Alaska. As he had learned how to weld in prison, he was able to fend for himself. By the time he was an adult at age 30, he had moved back to Colorado. He took a job that was well paid, but unfortunately, he had a work-related accident in which his wrist tendon was injured. He was prescribed opioids to deal with the pain, and this was an opportunity for him to abuse the drugs. He moved on to heroin by intravenous administration, where he contracted hepatitis C, and in no time he had become an addict. Soon after, he was arrested again for possession of controlled substance. He got bail on bond and decided not to appear for the frequent drug testing required by the court. This led to another arrest, and he was sent to jail. His time in jail led to a severe worsening of his medical condition due to withdrawal from heroin. He presented with symptoms like diarrhea with nausea and vomiting, of which he was prescribed loperamide and meclizine. He told his lawyer and family about this when they visited. Still, all he got was a physician assistant within the correctional health unit during his 90 days in jail. He was eventually sentenced to. He had an increased blood pulse coupled with low blood pressure. The physician assistant requested for him to be taken to the hospital. However, the policy and regulations of the jail did not allow for this to happen. He ended up with acute renal and respiratory failure, pneumonia, and other symptoms. After this, he was transferred to an emergency room in the hospital in Denver from Colorado, where he was placed in a coma as he needed several intervention procedures like partial lung removal. The inmate and his family sued the correctional health facilities and everyone involved in the delay of medical treatment, even though their spokesperson said he was never denied access to healthcare during his time in jail. From the story, I can tell you there are lots of disadvantages when you're depriving teenagers or young adults from proper health access to prison. And in the story, we can see a lot of those disadvantages, especially adverse effects on the physical well-being of the individual mentioned in the case study. We need to understand that although these people have committed various crimes, they are still human beings. As some of you might know, I'm an aspiring aerospace engineer, and if you see that sentence about him accompanying his aeronautics father, you can see that he had an personal interest in an occupation, and it is so sad that he didn't have an opportunity due to his situation. I also feel that it's really not acceptable for them to be treated in this manner. And this is not just for children in prison, but for children in general, because whether we like it or not, there are so many children who are getting deprived from healthcare for various other factors. Some of the factors which are affecting access and utilization of health services among children aged 0 to 17 years. According to the 2018 National Healthcare Quality and Disparities Report, children that are aged 0 to 17 and have activity limitations or need or use of more healthcare or other services than is usual for most children of the same age are described as having special healthcare needs, which was said by Agency for Healthcare Research and Quality in 2019. For example, children in US prisons have reduced activity and usually need counseling under mental health services compared to their counterparts who are not in prison and who qualify for this classification, called 2019. The survey in 2018 National Healthcare and Quality and Disparities Report asked various questions to classify children as having special needs. The positive response to the questions asked like the need or use of medicines prescribed by a doctor, the need or use of more medical care, mental health care, or education services than is usual for most children, limitations or inability to do things most children can do, the need or use of special therapy such as physical, occupational, or speech therapy, and the need or use of treatment or counseling for emotional, developmental, or behavioral problems. Further confirm the qualification as a child with special healthcare need. The Agency for Healthcare Research and Quality 2019 provided results for children who had a doctor's office or clinic visits in the last 12 months and needed care, test, or treatment who sometimes or never found it easy to get the care, test, or treatment. The results were based on the data for years 2008 to 2016 and analyzed by the age, gender, ethnicity, level of income, or insurance type, as well as residence type, and are presented below. Age. As children approach the adolescent age stage, they tend to think they are adults and do not need guidance. At this stage, they experiment with everything. This is what was observed in the case study, where a teenager stole a car and was convicted and sentenced to prison. Mental health was an issue for the child as he progressed to adulthood. As is common at the teenage stage, he faced peer pressure and found himself addicted to heroin. He now not only had mental health issues from his adolescent stage, but hepatitis C, an infectious disease that also requires a specialist. The data represented in Figure 1 shows that there were more children aged 6 to 17 than aged 0 to 5 recruited for the National Healthcare and Quality and Disparity Study of this population. Figure 2 reveals that ages 6 to 17 were denied access to healthcare in 2012, 2015, and 2016, more than the younger age group, the Agency for Healthcare Research and Quality 2019 says. Here we have figure 1, which is showing the total amount of children interviewed for access to healthcare by age. Here we have figure 2, which is showing the percentage of children denied access to healthcare by age. The next factor is gender. As mothers are concerned with decisions regarding their children, like immunization schedules and the choice of healthcare provider, they need to understand the importance of accessing quality healthcare and in good time. Figure 3 shows the total number of children interviewed by gender, while Figure 4 reveals that in 2011 and 2014, more males were denied access to healthcare, and in 2019, 2015, and 2016, there was a change in trend with female children being more likely to be denied access to healthcare. The results might be a source of insight for reasons why teenage pregnancy and poor mental health persist among the female group, especially those in US prisons. Black, Nugent, and Variation, 2016, Brooks et al., 2020, Cole, 2019, Daniel, 2019, proof. Ethnicity. The case study did not say the ethnicity the teenager belonged to, so it is not easy to classify if he was more prone to being denied by ethnicity. However, the results presented in Figure 5 revealed more children from non-Hispanic or races than Hispanic or races with non-Hispanic blacks, being the least number for children interviewed, hence the minority in the study, and is a reflection of the US population. Figure 6, however, revealed that Hispanics all races were the most denied access to healthcare, except in 2015 and 2013, when non-Hispanic blacks were most denied. Figure 3. This figure is showing children interviewed by access to healthcare by gender. Figure 4 is showing the percentage of children denied access to healthcare by gender. And Figure 5 is showing the amount of children interviewed for access to healthcare by ethnicity. Figure 6 is also showing the percentage of children denied access to healthcare by ethnicity. The next factor is level of income, type of insurance, and residence type. As described in the case study, the teenager grew up in Pueblo, Colorado, an urban residence with all the modern city attraction. He had access to healthcare due to location, and as his father was wealthy, he was from a home with a high income, even though it was not revealed if he was on any health insurance. However, during his time in prison, he was restricted to the prison walls and could not get the appropriate health care he needed. He was therefore denied health care by residents in prison. Figure 7 showed that of children interviewed, there was a reduction in the number of children in the high-income category. In contrast, Figure 8 shows that children described as negative or poor were denied access to healthcare more than their counterparts. Figure 9 showed that there was about an even distribution for children that had either public or private insurance, while uninsured children were not analyzed due to statistical limitations. Figure 10 showed that children with public-only health insurance were denied access to healthcare more than their privately insured counterparts. The children interviewed by residents comprised mainly of metropolitan homes, as shown in Figure 11. In contrast, the large central metro and medium metro children were denied access to healthcare more than their counterparts, as shown in Figure 12. In Figure 7, we can see the amount of children interviewed for access to healthcare by their level of income. We have the middle income earners, high income earners, negative or poor, near poor or low. Then Figure 8 is showing the percentage of children denied access to healthcare by their level of income. This is showing the same thing but in contrast to what the previous figure. Note, in 2013, 2012, 2011, and 2008, children with high income were described as DSU. Data did not meet the criteria for statistical reliability, lesser quality, or confidentiality. Figure 9, we can see the amount of children interviewed for access to healthcare by insurance type. And we can see in Figure 10 the percentage of children denied access to healthcare by insurance type. Uninsured children were not used for statistical analysis as they were described as DSU. Data did not meet the criteria for statistical reliability, data quality, or confidentiality. Here we have Figure 11 showing the children interviewed for access to healthcare by residence type. Figure 12 is showing the percentage of children denied access to healthcare by residence type. Some recommendations I would like to tell you. Reasons why children are denied access to healthcare are numerous. As shown by the data presented in this chapter, services like mental health and preventive methods for teenage pregnancy should be improved and easily accessed for both boys and girls of adolescent age, regardless of race, geographic location, or level of income or insurance. Mental health services are quite helpful in preventing children from becoming convicts, felons, Call 2019 says. Avoiding teenage pregnancy will keep the adolescent healthy and reduce mother and child mortality. Mental health is still a significant problem for inmates, as revealed by various studies. US prisons should be well equipped for inmates for all forms of regular and specialty health services cases. There should be communication between prison officers and community health centers so that inmates can be transferred to healthcare services when appropriate. The summary of this chapter. Because of a lack of use of preventive services like mental health services, effects such as children in prisons occur, leading to poor health outcomes for the children. In a study by Black Nugents and Variation in 2016, it was revealed that in 2014, the percentages of adolescents not having a usual place for preventive care, not receiving a well child checkup, and not having a dental visit were higher for those aged 16 to 17 compared with those in younger age groups. These percentages also varied by race and ethnicity, poverty status, and insurance status. Their results agrees with the National Healthcare Quality and Disparities reports that are presented and analyzed in this chapter. The case study explains how a teenager was taken to prison and how this affected his mentality. US prisons should provide training for medical personnel specializing in handling cases for patients within confined spaces such as prisons. The references in this chapter: Agency for Healthcare Research and Quality, 2019. Black, Non-James and Variation, 2016. Brooks, Pace, Gowen-Smith, Packer, Murray, Varani, Han and Hunter, 2020. Community Call S 2019, The Jail Healthcare Crisis. Daniel, 2019. National Healthcare Quality and Disparities Report, 2018. Thank you all for listening to this presentation. I have been more than happy to present this to you. And if you would like to read more on this book, you can find it on Lulu Books website. The name is Economic Evaluation and Marketing for Healthcare Professionals by Abidoba Oyekenu, and all the rest of her books are on there as well. Thank you and bye.